Hello, my name is Dr. Monica Flores, a pediatrician in South Florida since 2001. And today I'm going to teach my pediatric residents how to go through metabolic labs, would be the labs that I order at a well child visit, via CBC and the lipids at 11 and 16 years of age. If the child has any risk factors starting as young as 2 years of age, factors being a family history of cardiac disease, increasing BMI, then I may do more complete labs. I may end up doing a CBC, a lipids, a CMP, which is a complete metabolic profile, includes the liver, the kidneys, and the electrolytes. Also includes the sugar, hemoglobin, A1C, insulin, TSH, and free T4. Remember, I have these in lab sheets that I have like the regular well labs, your abdominal pain labs, and I have those lab sheets available for people. If you want them, just email me. Remember that when you order labs, you get credit, medical decision-making credit, for only either ordering the labs or reviewing the labs, but not both. I had already addressed the need for the labs at a certain visit. Hey, your BMI is elevated. I think we need to check to make sure that there's no complications, and you included that as your part of your medical decision making, and you use those labs for your data points. When you review, you're going to do it by time. Remember, time is the same day. Time it took you to review the labs, summarize them, the face-to-face time, and then any care plan that you had to do that was done by yourself and not your staff. Usually when the abnormal labs come in, I'll just look at them quickly, make sure that there's nothing crazy in there and there's nothing that I have to deal with that minute, and I'll just say abnormal labs schedule. And then the morning of the patient coming in, I usually am here in the office about an hour beforehand. I go through my whole schedule. If I see that I have a patient that I need lab review, then I'll review the labs. I personally like to have the labs in paper form. I use that piece of paper to then talk to the patient, and I write on that piece of paper. I'll use the care plan that we came up with. But it's a really nice overview care plan of what you're going to do, and you can kind of make it fun as a contract with the patient. Hey, this is what we're going to work towards. These are going to be our goals. When they leave with the paper of the labs, and they leave with the paper care plan. And then they leave with a plan of when are we rechecking labs or rechecking BMI or what are we doing for the next visit. Lab review can be anywhere from 99212s, like a 10-15 minute one, is usually a parent. I've already talked to you about everything. It can be up to 30 minutes for a patient where they have a lot of risk factors and we are addressing the healthy habits.